Hello everyone, and thank you for joining me today. In this presentation, I will be discussing maternal mortality in Nigeria, which remains one of the most serious public health issues in the world. Nigeria continues to report one of the highest numbers of maternal deaths globally, and what makes this issue especially troubling is that the majority of these deaths are completely preventable with the right healthcare systems and resources. So, today I'm going to talk about what maternal mortality actually means, why Nigeria is also heavily impacted, who is most at risk, and the major factors that contributes to these deaths. Also, I will discuss trends over time, the real-life consequences for families and communities, and the most effective strategies for prevention. By the end of this presentation, I hope to show why addressing maternal mortality is not only a medical issue, but a social and economic issue as well. Maternal mortality refers to the death of a woman while she is pregnant, during childbirth, or within 42 days after giving birth. These deaths must be related to pregnancy or its complications and not from accidental or unrelated causes. What makes maternal mortality participle concerning is that most cases are preventable. With timely medical care, trained health workers, and proper equipment, women should not be dying from childbirth in the 21st century. So, maternal mortality is also used as a key indicator of a country's healthcare system. When a country has high maternal deaths rate, it usually means there are major problems in access to care, healthcare quality, transportation, and infrastructure. So, studying maternal mortality helps us understand deeper public health issues. So, why I chose Nigeria for this project? It's because the country faces one of the most severe maternal health crises in the world. According to the World Health Organization, Nigeria recorded about 33,000 maternal deaths in 2020 alone. To put that into perspective, this means that roughly 20% or out of every 5 maternal deaths globally occurs in Nigeria, even though the country represents only a small percentage of the world's population. This tells us that something is deeply wrong in the maternal healthcare system. High population size does play a role, but the real problem is lack of access to quality care, shortages of trained health workers, and delays in receiving emergency treatment. For these reasons, Nigeria is a critical country for understanding maternal mortality. So, the leading causes of maternal death in Nigeria are well known and mostly preventable. Postpartum hemorrhage or severe bleeding after childbirth is the number one cause. So, when a woman doesn't receive a proper treatment within minutes, hemorrhage can quickly become fatal. Hypertensive disorders like preeclampsia and eclampsia are also major contributors. They involve sudden high blood pressure, seizures, and organ failures. These conditions can be managed if dedicated early through parental care. So another major cause is sepsis, which is a severe infection that can happen after childbirth if sterile procedures are not followed. Obstructed labor occurs when the baby cannot pass through the birth canal, and without a C-section, it becomes life-threatening. Finally, unsafe absorptions cause many deaths because women often lack access to safe reproductive health services. So all of these causes highlight gaps in emergency obstetric care. When we look at maternal mortality by person characteristics, certain groups of women face significantly higher risks. So women living in rural areas are the most vulnerable because they often live far from hospitals and lack access to emergency transportation. And low-income women also face barriers. They may not be able to afford hospital fees or parental checkups. And teenage mothers are at high risk due to biological factors and limited knowledgeable of pregnancy complications. So education plays a huge role as well. So women with higher education levels are more likely to seek early care, recognize danger signs, and deliver at a health faculty. Another major factor is whether a skilled birth attendant is present. In many parts of Nigeria, women deliver at home with transitional birth attendants who are not medically trained, which increases the risk of complications leading to death. Maternal mortality does not happen equally across Nigeria. Some areas have much higher risks than others. The highest deaths rates are found in the northern part of the country and in very rural, remote villages. These places usually do not have well-equipped hospitals. Many clinics don't have enough doctors, nurses, or trained midwives, and sometimes they don't even have basic supplies like clean gloves or medicine. And another major problem is distance. Many women have to travel a very long way just to reach a hospital, and even when they want to go, transportation is often unreliable, too slow, or too expensive for their families. In emergencies like severe bleeding, every single minute matters. A delay of even 10 or 20 minutes can be life-threatening. And poor road conditions also make it harder for women to get help quickly. Many rural communities don't have ambulances at all, and even if they do, it can take a long time for the ambulances to reach the community. All these geographic challenges create a big difference between women living in cities versus women living in rural areas. This inequality, just based on where a woman lives, is one of the biggest reasons why maternal mortality remains so high in Nigeria. When we look at maternal mortality over time in Nigeria, there have been some small improvements, but not enough to make a big differences. The number is still very high. One reason is Nigeria's population keeps growing, so even if the rate improves a little, the total number of maternal deaths stays high because more women are giving birth. Another important factor is that the COVID-19 pandemic. During the pandemic, many pregnant women missed their prenatal appointments because clinics were closed, understaffed, or overwhelmed. Transportation was harder because of lockdowns. Many hospitals were focused on COVID cases, so maternal health services received less attention and resources. And overall, even though there have been some positive changes, the improvements are too slow. Women still face many risks during pregnancy and childbirth, and the progress over time has not been enough to protect them. There are many barriers that make pregnancy unsafe for women in Nigeria. So, one of the biggest issues is the lack of skilled birth attendants. Many women give birth at home with traditional birth attendants who are not medically trained. So, if a complication happens, there is no one who can handle it quickly and safely. Another major barrier is limited emergency obstetric care. In many areas, hospitals cannot perform C-sections, blood transfusion, or other life-saving treatments. Some hospitals don't have enough electricity, clean equipment, or medications. Without these tools, women are at higher risk. And cost is also a huge challenge. Many families cannot afford a parental care, transportation, or hospital fees. This causes delays because families try to manage at home first, and by the time they reach a hospital, it may be too late. And cultural beliefs are also matter. In some communities, home birth are preferred because they are traditional or because people trust local birth attendants more than hospitals. But when complications happen, home births can become very dangerous. All of these barriers combined make pregnancy much more risky for Nigerian women. Real impact of maternal mortality is heartbreaking and goes far beyond numbers and statistics. When a mother dies, her newborn baby often has a much higher chance of dying, especially within the first few weeks of life. Babies need breastfeeding, warmth, and construct care, and without their mother, their survival becomes harder. Families also experience deep emotion pain. Losing a mother affects everyone: her husband, her children, and her extended family. It can break the family apart emotionally and cause long term trauma. Economically, the loss of a mother can push a family deeper into poverty. In many Nigerian households, women help support the family through work or farming. They also take care of the home and children. Without her, the entire family struggles financially and socially. Communities suffer too. When many women die, it affects health, education, and economics development. So, maternal mortality is not just an individual loss, it is a community and national issue that affects future generations. So, there are several solutions that have been proven to reduce maternal deaths. One of the most important is making sure women have access to skilled birth attendants, people who are trained to deliver babies safely and recognize complications early. Emergency obstetric care is also essential. This includes having access to C sections, blood transfusions, and life saving treatments for conditions like hemorrhage or eclampsia. Even small improvements in emergency care can save thousands of lives. So, parental care is another big solution. When pregnant women attend regular checkups, healthcare providers can detect problems early, such as high blood pressure or infections, and treat them before they become dangerous. Safe delivery practices like clean equipment, hygiene, and proper monitoring also help reduce infections. Education is key too. When women and families understand danger signs, they seek help sooner. Teaching women about their health gives them power to protect themselves and their babies. These prevention strategies show that maternal mortality can be reduced if women receive the right care at the right time. To reduce maternal mortality, Nigeria needs strong public health strategies. First, the healthcare system must be strengthened. That means better hospitals, more equipment, constant electricity, clean water, and enough trained staff. Training more midwives and nurses is very important because many communities don't have enough skilled workers. Rural clinics need to be expanded so women don't have to travel long distance to get basic care. Transportation system also need improvement. Better roads and more ambulances can make a huge differences, especially during emergencies when every minute counts. Affordability is another key issue. Healthcare services should be affordable so women don't delay going to the hospital because of money problems. Lastly, public awarenesses must increases. Communities need education about the importance of skilled birth care, prenatal checkups, and recognizations danger signs early. When communities are informed, more women survive pregnancy and childbirth. In conclusion, maternal mortality in Nigeria is a preventable tragedy. Thousands of women die every year from causes that can be treated or avoided with proper care. This issue is not only a medical problem, it is a social, economic, and public health emergency. With stronger healthcare system, more trained birth attendants, better emergency services, and greater community awarenesses, Nigeria can save many mothers' lives. When mothers survive, babies survive, families stay together, communities grow stronger, Every woman deserves a safe pregnancy and a safe childbirth experience. Reducing maternal mortality is one of the most important steps toward improving health and well-being in Nigeria. Thank you.